Students, today we are going to study systemic hypertension once again. Uh, let's know what is hypertension first. Hypertension is also known as high blood pressure, and hypertension is a condition in which the force of the blood against the artery wall is too high, and because of this high pressure on the artery, we, we can record the blood pressure, and if the pressure is very high than the normal range, then we call the condition as a hypertension. Usually hypertension is defined as blood pressure above 140 by 90. So this is the upper limit above which, if the value is coming higher, then we can predict as a hypertension. Considered severe if the pressure is above 180 and by 120. So here there are two values are there, 180 by 120. 180 is a systolic level and 120 is the diastolic. So 180 systolic and 120 is the diastolic. If the pressure is up to this level or above this level, then we can consider the severe level of the hypertension. High blood pressure often has no symptoms. Okay, so people may not experience any symptoms, and based on that, there can be the certain complications because of the high blood pressure. Over time, if untreated, it can cause health conditions such as heart disease and stroke. So this is what we can experience. The patient usually, uh, the heart may get affected particularly. So cardiovascular disease is one of the major organ disease. Okay, which is mainly affected. Okay, let's know about systemic hypertension. Systemic hypertension, does it means? Before knowing systemic hypertension, we should know the circulation. There are two types of circulation in our body. There is a pulmonary circulation, and the second is the systemic circulation. Okay, so pulmonary circulation, what does it mean? That this is the circulation between the lungs and the heart. Okay, where the heart pump the blood towards the lungs through the pulmonary artery, and the lungs again purify the blood and then again uh, return the blood to the lungs, to the heart, sorry, through the pulmonary vein. So this is the pulmonary circulation. But today we are learning about the systemic hypertension. So we should know the systemic circulation. What does it mean? Systemic circulation means here the heart pump blood uh, through the aorta, okay, to the body parts, okay, and the body cells and tissues take the oxygen and again return the blood to the vena cava to the again heart. Okay, so the blood circulation between the heart and the body's tissues are the systemic circulation. And here, this is what there can be the blood pressure higher in the systemic blood vessels. Okay, so here systemic hypertension means it's a high blood pressure in the systemic arteries. So systemic arteries, basically the larger arteries, aorta and the other arteries, subarteries. Okay, so there can be the higher level of blood pressure. So systemic arteries means the arteries, okay, uh, which supply pure blood to the cells. The blood vessels that carry blood from the heart to the body tissues are systemic arteries. Okay, and uh, the high systemic blood pressure is usually caused by the constriction of the small arteries. Okay, so the systemic blood pressure becomes higher. Okay, usually because of constriction of the small arteries or arterioles, and during the constriction, the pressure is experienced as a high blood pressure. There are two types of hypertensions are there based on systemic hypertension. Okay, so systemic hypertension are of two types. One is a primary hypertension, and the second is secondary hypertension. Primary hypertension is also called as essential hypertension. which is idiopathic, means the reason is not known, the cause is not known. Whereas secondary hypertension, here the it can be the because of the renal disorder, or it can be the because of endocrine disorder, or sometimes it can be the because during it can occur during the pregnancy. Okay, so there are two major types of systemic hypertension, primary and secondary. Primary is sometimes called as essential hypertension. So etiology of essential hypertension, that is what we say the primary hypertension. Etiology means the cause. The one of the cause is genetic factor, which it tends to run in families. So gene, if it is if anyone from paternal side or maternal sides are affected, so it can pass the disorder to their progeny. It can be fetal factor, okay, fetal factor where there can be low birth weight, or maybe because of the crucial hormonal system, which can also can increase the blood pressure. Okay, so during the pregnancy, the hormonal imbalance may occurs, or so because of that hormonal crucial hormones can be responsible for increase in the blood pressure. So what we call as a fetal factor, where and during the development of the fetus, or sometime during the delivery time period, when there is a uh, delivery time, at the time the blood pressure becomes higher. Okay, so next is obesity. Some people who are fat have a higher blood pressure than the thin people. So this is what happens. The obesity may leads to change the blood vessel structure. The deposition of the fat can also be one of the leading reason of the high blood pressure. Alcohol intake can also be one of the reason for high blood pressure. Sometimes alcoholic person may experience high blood pressure. Sodium intake is directly proportional to the higher blood pressure. Stress, acute pain or stress can raise blood pressure also. So when people who are under the stress, or maybe because during the some pain, okay, so the blood pressure is higher. So essential hypertension is also known as what we consider as a primary hypertension, and this is the most common of high blood pressure. Approximately more than 90 to 95% cases are essential hypertension, and it has no clearly identifiable cause. The cause is not identified, not defined, and thought to be linked with what we understand as a genetics, maybe sometimes poor diet also lack of exercise and obesity and fetal factor, environmental factors. So many things are there which are related to the essential hypertension. Secondary hypertension, we can say it has an identifiable cause such as kidney disease, where the renal artery stenosis may be one of the reason. Prevalence, basically 5 to 10% of adults are usually with the hypertension. Okay, so secondary hypertensions are less prevalent than the essential hypertension, and here the age group are basically the young adults, and particularly experienced by the women. So this is the difference we can summarize between the primary hypertension and secondary hypertension, where the prevalence is 90 to 95% cases. In the secondary hypertension, the prevalence is 5 to 10% cases, and the cause of the primary hypertension is not known, whereas the cause of secondary hypertension is its identifiable cause, we can say, where usually secondary to any condition. We can say the patient might have a renal disease, might have an endocrine disorder, might have pregnancy or some other conditions. In response to that, there can be the hypertension for the short period of time. So we have completed the systemic hypertension. Uh, okay, if you have any question, we can discuss here now.